They're the province-wide hotspots for COVID-19, long-term care facilities. Of the 713 deaths in the province, 516 of them were at long-term care homes. That includes 40 deaths at Orchard Villa in Pickering, 37 at Eatonville Care Centre, and 32 at Seven Oaks Long-Term Care Home. The Ministry of Health is changing how it is reporting on COVID-19 at long-term care and retirement homes, now using figures consolidated directly from the Ministry of Long-Term Care, which the province says will lead to more timely information.
I relate to it in our own family, as I mentioned, with my wife Carla, and or the person that got on a cherry picker. Anyways, the system, we can do better.
An emotional Doug Ford talking about his 95-year-old mother-in-law who's tested positive for COVID, living in a retirement home. Ford admitted the system needs to be changed, but for now, protection of those residents is paramount. The military has even been called into 5 as-yet unnamed homes to help ease the crisis. We're joined now on the phone right now by Long-Term Care Minister Dr. Merrill Fullerton, who oversees the homes. Welcome to our show this morning, Doctor.
Thank you. It's Merrily, just so we're clear.
I apologize.
No worries.
Well, let's start with what the Premier had said yesterday about the need with more to be done with the system beyond, obviously, his emotional account and his personal account. What would you say needs to be done at this point, and what kind of lessons are we learning?
Well, I want to acknowledge, first of all, how devastating that is, the loss that we're seeing right now and feeling this loss. It is devastating. I've been a family doctor for almost 30 years, gone through long-term care system with family members, and I can only imagine what it's like for everyone right now. So looking at the capacity issues that we had in long-term care leading into this, the staffing shortages leading into this, these were long-standing issues, and we were working extremely hard to remedy those leading up to this. And then when the pandemic hit, it has accentuated these problems and really put a lens on all the things that need fixing in long-term care. And that is what we are committed to doing. The health and well-being of residents in long-term care and staff is a priority and will continue to be a priority. That will be a focus going forward. But we have an enormous task at hand, and as you mentioned, the military has been called in to assist. Hospitals are being activated to assist. Our home care sectors, our portals to rally volunteers to give us help in long-term care. You know, we have over 78,000 people in long-term care, one of the highest numbers in all of Canada, and a long wait list. So this is clearly something that we have to fix.
You had mentioned bringing in extra help. We know that there will be at least 5 homes that are going to be getting help from our military. At this point, are you able to tell us, we've heard some new developments in terms of the different homes that have been affected. Can you tell us at this point which homes are going to be getting that help?
Well, I can't say that yet. Things do change, hourly sometimes, and when we have that settled, it will be done. So we know that homes at risk typically have high staffing, critical staffing shortages, high need for staff, and there may be already receiving IPAC support from the local hospitals, but we need people to get the care into the home so the residents can be supported and give relief to the other staff that have been holding the front lines so valiantly. This is really a war against COVID-19, and the military really is the cavalry here. Right now, we keep a very close track of the homes that are what we call red, in the sense that they are likely to be in distress if we don't act with further measures. And so we're on that regularly, and that changes hour by hour.
Late yesterday, we had heard some developments with the Ontario Nurses Association winning a court battle about safety precautions of 4 different long-term care facilities in the province and the need for PPE by staff there. Can you tell us more about what happened and why it got to this point where it went to the courts?
Yes, and I'd like to be absolutely clear on this. The masking guidelines have been in place, those have been there all along. For anyone thinking that this means that our staff were not provided with proper masking or PPE, we have been keeping up with that, although in small amounts, because as you've heard, there are shortages coming into Canada for a variety of reasons. And so but I want to be absolutely clear that we have had PPEs necessary and following the Chief Medical Officer of Health guidelines on that. And as well, everyone knows that infection prevention and control is a major focus, and all measures have been taken. And again, this comes through public health. So there are differences between surgical masks and N95s. That's another type of mask. So the N95s are typically used where there might be intubation or, having to put a tube down into someone's airway for a ventilator. But they are more for aerosol spread rather than droplet spread, which is the surgical masks. But even that science is something that we've been following very closely through the Chief Medical Officer of Health. But as understanding of this virus evolves, our experts in the scientific evidence of this virus will keep up. So this is something that we're working hard to understand. But I want to be clear, infection control practices, all our homes are required to follow those, as well as masking guidelines.
Ontario Long-Term Care Minister Dr. Fullerton, thanks for joining us this morning.
Thank you so much. Take care.
We'll be right back on Breakfast Television.